Rachel.
Hi, Brittany.
We are back again with another episode of The Way the World Works. And today I want to talk about what happens when the government controls health. And spoiler alert, it's not good.
It's not good.
It is not good. You know, there's always a conversation going on in the country about how bad our healthcare is and how bad health is. And people are very quick to blame, private insurance companies or private, entities of different sorts that are in the healthcare industry. And I'm not saying they're blameless, but I'm saying there's a bigger problem. And that is that we have given the government too much control. And we've talked about this before, what the word like corporatism means. And that is that you have all these private entities like insurance companies that aren't really private anymore because the government's giving them so many special privileges that they've really just become like this weird Frankenstein of a creature where they're mixed together and just up to no good. So there's a lot of ways that has come together to make us more unhealthy. But there's even some more blatantly obvious ways that the government has done that. And I want to start with talking about enemy number one, which I think is the silliest thing that the government ever did. And that was something called the food pyramid. And Rachel, I'm sure you know that when we were younger and we were in school, well, you were in Haiti. You might not have
for a few years,
But, our teachers would have like a unit on health, and they'd say, if you want to be healthy, if you want to lead a healthy lifestyle and not get sick, you follow this pyramid. And it was, what was it? The biggest part was all just bread.
Lots of carbs
and
carbs
like
at the bottom.
Good. Don't get me wrong. The bottom of the pyramid was my favorite. Like I would eat nothing but the bottom of that pyramid if I could. But that's why we're unhealthy. So wait, then what was the next one? It was grain, pasta, bread, rice. Then
it's like carbs, and then some veggies.
It was it was like meat, dairy,
eggs.
We'll have maybe in the post editing we'll see if we can get a little picture of the food pyramid up there so you guys can see it. Mm-hmm. But it was just this. The vegetables are like at the very top, and it's like a small little thing or towards the top, and it was so silly because they fed us this lie, no pun intended. Get it? Fed us this lie. So funny, guys.
You're so funny. Brit the Wit.
They told us that this was the way to be healthy. And oh my goodness, shocker, we're now very unhealthy. And obesity rates are off the charts. And people have, obesity causes so many health problems. That is actually like the number one factor for all other problems. I mean, we saw that with COVID, where it was like people with these comorbidities that means like you have these underlying health issues and being overweight and obese was one of them, were more susceptible to dying and getting sick. And so we don't teach people to take care of themselves. Instead, the government slaps up this weird food pyramid. And, Rachel, where did that food pyramid even come from? Do you even know?
The imagination of some bureaucrat that gave themselves too much credit. Fact check that.
And there's also, and to my understanding, there's also some lobbying that went involved with that. So there's, the corn subsidies. Everything is made from like high fructose corn syrup these days instead of sugar. And sugar is not great for you either, but there's all this corn and the government was giving all these subsidies, these tax breaks, basically letting them off. Yeah. I mean, I don't want any of us to pay taxes, but they were giving them these special privileges to make more corn and to use more corn in everything. And it's made us less healthy. It's made us, it's been terrible for the health of the American people.
Here's a good thing to research, and that is the Farm Bill and the history of all these subsidies. Because like the industry of farming has become very, very different from what it used to be. And I have family, actually, aunts and uncles and cousins in Iowa that have a massive 2,000-acre farm. And so I've learned a little bit about how these major farms work, but basically it's not a free market. It's not a free market at all. It's all based on what the government will pay you for your crop. And a lot of times they end up with too much of a crop, so they have to dump it on the third world. Like that's why countries like Haiti, that's why they eat so much rice, is because American farmers are subsidized to grow too much, and then they dump it on the third world, thinking they're doing something good. And then, I mean, it's not that nutritious of a food. So,
But it was high calorie for low amounts.
Yeah. So, and the other thing that we have along with obesity here is also, ironically, malnutrition. So we're eating a lot, but we're not getting the nutrients that we really need. That's why we need to take so many multivitamins, you know. I don't know if you've ever noticed, but when you go off of your multivitamin for a while and then you start taking it again, like how great you feel. I don't know if anyone can relate to that, but I've noticed that.
I think I should start taking a multivitamin. I do like the green powders. I do a lot of like the green powders.
I mean, same thing, like these supplements to get nutrition where
from
it's not
the food
coming
that used to give us nutrition.
Yeah. So you get fat, but you don't get the nutrition that you need. It's a very tangled web that food and agriculture has become since government intervention, and that leads to more government intervention. And really what we need is to just back the government out of it and look at real science about what we should be eating.
Well, and I like that you said science, because you're going to help me get into my next point, and that is we're not asking people to be well. We're not asking them to live healthy lifestyles, right? We only bring in the science when they're sick. And that's such a perverted way to view health, you know, in this world. And we saw this a lot with COVID. What shocked me the most during COVID is there was never any talk of, oh, take vitamin D. You know, go for walks. You should be working out. No, instead it was stay in your house. Don't go out in the sun, which is the greatest source of vitamin D. Don't do this.
Yeah.
Don't do that. And then if you do, you're gonna die. You're gonna get this person sick. And there was all this fear mongering, and it was trust the science. You have to listen to us. Trust the science.
And they closed the gyms, but kept the alcohol stores open. Really?
Exactly. And then you know what happened? People were drinking more alcohol, and that was making them, you know, sad. And there was a lot of mental health problems. And we were being fed all these scare tactics while also being told that the government science was the only one that was right. And, you know, Connor and I started this podcast during the pandemic, and Connor and I knew what was going on then, right? We I think a lot of listeners probably were too, but I think what's so funny now, we are almost 5 years. Isn't that wild? We are almost 5. Some of our listeners may not have even been born or just very little, which is also crazy. But, you know, now we're almost 5 years removed, and now we're finding out that we were right, you know, that there really wasn't a lot of science to this, that the stand 6 feet away from people social distancing was a made up number. There was no science.
It's totally
about
made
this.
up. Yeah.
That these thin masks were going to save us from an, you know.
I knew that was wrong from the start. Kids, that was not normal. What we went through during the pandemic, that's not normal life. And hopefully that was just an anomaly. That's another good word. The anomaly meaning just a weird thing.
Like a once in a blue moon thing.
That just passes. And I do believe we are far on the other side of it. I hope we've really learned some lessons from it, and that never happens again. But in a lot of ways, that was a libertarian nightmare. What we went through.
But I mean, it was a dystopian nightmare is what it was, but it was a learning, you know, thing. And we're still learning, you know, when it comes to health, the way that people, especially young kids who, you know, school, you're a parent and I was a teacher. I was never sicker than I was when I was a teacher because you kids are all riddled with germs, but it's because you're building your immune systems. And even though it's hard as an adult to be getting all your germs, that's how you build these strong immune systems that turn you into healthy, strong adults. But you didn't get that opportunity because you kept in your house and you were isolated from other kids. So then your immune system didn't get this opportunity to grow big and strong. And so then, what was it, 2 or 3 years after COVID, all these kids were getting sick with, you know, all these like RSV, like colds and flus and strep throat. These things were coming back, and it's because the government, and I like to, you know, if we give them the benefit of the doubt, we can say it was an unintended consequence, something they didn't plan on. It's hard for me to give them to the benefit of the doubt sometimes, but, you know, it's made us sicker by not letting us weigh our risks and get sick, we've now been open to more sickness. And so this science, this government is making us less healthy.
One of my favorite things to talk about is the concept of an educated immune system. You educate your immune system like you work out any other muscle. And getting sick is normal. It's normal. You're supposed to fight off germs because it helps you then fight off things like cancer. So getting sick is normal. You're supposed to. And in any case, you can't avoid it. You can't live in a bubble. You have to interact with the world. And part of that is having an immune system that can tolerate a normal amount of the biosphere and the germs that go around. So, and then somehow during the pandemic, we forgot that.
We forgot it, or I think fear. I mean, I think people like us, and a lot of our listeners didn't forget it. But one thing, and again, I know kind of we sit here in awe when we talk about the big pandemic because it's just so baffling how quickly it happened and how much people did just buy into that when we know the stuff like, what did you call it? The educated immune system. I love that.
Immune system.
That we know what happens with those kind of things, but fear can get the best of us. It really can. In fact, Connor wrote a book, Feardom, I believe. I hope I didn't get that. I know I got the name right because I read it. It's Feardom. That was one of the earlier books I read of Connor's, actually. So that's a great book. Probably not for kids, but for adults. So that's a great one that talks about how they use fear. But yeah, you have to be very careful when somebody is trying to make you afraid, because if somebody can make you afraid, they can control you. So, and that's a lot of how they got through all of those pandemic policies that were so anti-liberty is people were scared out of their minds of what I believe. I mean, it was a bad cold virus, but it ultimately a coronavirus is a cold virus. It's a cold virus.
So just be careful when people try to scare you. Be careful that you stop and think still.
And when it comes to health, I started the episode out by asking a question: what happens when the government controls your health? And the answer to that is we aren't healthy. Yeah. There is no health. It's gone. So we need to be very vigilant, which is another good word, constantly on guard and watching our backs, because the government is not out to make sure that we're healthy. One more thing, but I know we have to wind up here in a minute, but that always makes me laugh. So if you watch the commercial for sugar cereals, like Lucky Charms and things like that, it'll always say part of this complete breakfast. And you hear that. And I remember as a kid, I was like, well, it's healthy. Like, Mom, why won't you buy me Frosted Flakes? It's all sugar. It's healthy. It said it's part of a complete breakfast. And if you look at the side of the box, they'll say part of a complete breakfast. And it's like a bowl of cereal, eggs, an apple. Like, it's all these other things that actually are the complete breakfast. And so like to make it nutritious with that cereal, you'd have to eat like a million other actually healthy things.
We Americans have a big problem with making dessert breakfast.
And I will admit I am part of the problem. I love sugar. I'm a baker.
I've had a few bowls of cereal myself, so.
Cereal's not my thing. I like to make homemade cereal. I'm like one of those people where I'm like, I can make, but it still has sugar in it, so I'm just as bad, guys. But we will leave it there.
In moderation.
In moderation. That is right. We will leave it there for today. Again, we're hoping that you guys can take what we talk about and get some good conversations started, maybe around the dinner table for this one while you're eating your fresh veggies and good food.
Look into the Farm Bill. Look into what the Farm Bill is and the history of it. Yeah, that's a big driver of all this.
Yes. And don't forget to like and subscribe to the podcast, share with friends, and get a hold of Rachel and I on the Tuttle Twins Facebook groups, and let us know what you want to hear. Ask us any questions, what episodes you want to see, what questions you want answered, and we will do our best.
Ask us anything.
We'll leave it there. So until next time, Rachel, we will talk to you later.
Until next time.